I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on preventing shingles is one in a series of videos that provide information on commonly recommended immunizations. In order to discover what other videos we have available, you can click on our videos link at the website cornerstonefamilypracticemedicalgroup.com, cornerstonefpmg.com. The video is intended to supply general information. For specific decisions about your health, you should always talk with your personal doctor. Shingles is a very painful rash that is surprisingly common in the U.S. About 1 million people are afflicted annually in the United States, with at least half of those being over 60 years old. A vaccine has been available for several years to reduce the chances that you would develop the painful shingles rash. Should you get the vaccine? Well, I have spoken with many people in the midst of a painful, itchy shingles rash, and every one of them wished that they had received the vaccine. Let me tell you about the disease and show you some pictures of the rash so you can understand more about it. Before the rash develops, there's usually pain, itching, or tingling in the affected skin area for 1 to 5 days. Then a painful, itchy, burning rash develops with red blotches, often having deep blisters inside of the red blotch rash. The blisters come up, then scab over the course of 2 weeks and vanish, often leaving some scars. The rash occurs on only one side of the body, usually in a single strip on the middle of the body. But it sometimes involves the head, arms, or legs. Other symptoms can include fever, headache, chills, and upset stomach. Shingles is especially feared because sometimes there is a prolonged time of pain in the area of the shingles rash. Even after the rash goes away, it can be quite bothersome. The pain, called post-herpetic neuralgia, can last from 2 weeks to many months or even years. This type of pain is especially hard to treat, so it is better to prevent the shingles from ever starting. Shingles is also called zoster or herpes zoster and is caused by the same virus that causes chickenpox, which is called the varicella zoster virus. It is part of the herpes virus family that also includes the herpes simplex virus that causes cold sores on the lips. The chickenpox virus hides out in the nervous system of someone who's had the chickenpox in the past, as almost everyone over 50 years old has had chickenpox in the past. Then it comes down the nerves many years later to cause the shingles rash. To prevent the spread of the germ, we recommend that affected persons who have the shingles rash keep the rash covered, that they don't scratch the rash, and they wash their hands often. The good news is that the vaccine for shingles, called Zostavax, is recommended for use in people 60 years old and older. It is expensive, but most insurances help to defray the cost. For Medicare patients, it is covered under the Medicare Part D prescription plans. That's why most Medicare patients will receive the vaccination at a pharmacy that services the pharmacy Part D plan. The vaccine reduced the risk of shingles by about half, and it reduced the risk of pain after the shingles rash goes away by about 2/3. It works best if you get it when you are 60 to 69 years old, but still can provide some protection for older individuals. The vaccine is given as a shot containing live attenuated chickenpox virus. Attenuated means it is weakened in a way that causes an infection that boosts your immunity without causing you to feel badly. Currently, it is recommended to get the vaccine 1 time after age 60. Side effects happen occasionally and include redness, soreness, itching, or a small rash at the injection site. People with a weakened immune system should not get the shingles vaccine. This includes people who are treated with medications that weaken the immune system, such as steroids, people undergoing cancer treatments, and people who may be pregnant. The few people with serious allergies to gelatin or the antibiotic neomycin should also avoid the vaccine. If you would like more information about the shingles vaccine or would like to look at the vaccination information statement that is given to you when you get the vaccine, we recommend that you visit the CDC website at www.cdc.gov/shingles. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Its website has comprehensive and reliable information about vaccinations. Shingles is a painful, blistering rash that can cause prolonged pain in some unfortunate people. Please consider getting the protection of the shingles vaccine.